Now, the National Hospital Insurance Fund, NHIF, is yet again on the spot for irregular appointments of 11 staff members made way back in 2020. Appearing before the National Assembly's Health Committee, NHIF Acting Chief Executive Officer Samson Kuhora was at pains to explain how the said staffers were promoted to management level without the knowledge of the board, and that their payments backdated. As Abdiaziz Hashim reports, members of parliament have also stooped NHIF for procuring a new system that's intended to cost the taxpayer 4.2 billion shillings. They term it a waste of public resources.
The National Hospital Insurance Fund, NHIF, is once again in the eye of a storm, where it has emerged that low-ranked staff were promoted without the knowledge of the board.
This committee chair is in receipt of some irregular appointments which have occurred within the NHIF.
The National Assembly Chair, Robert Pukose, revealed that the 11 staffers were appointed to top management level and their payment backdated at the behest of the taxpayers.
Which would basically mean that the process was fraud.
Now, however, the confirmation of these individuals in some of these positions was done outside the board.
The salaries were backdated from 1st September 2020 to 30th April 2021. And this amount to millions of shillings to these individuals. And this amounts to loss of public funds, which must be surcharged from them.
NHIF Acting CEO Samson Kuhora and NHIF Chairman Michael Kamau stated they are aware of the matter and it is currently before the Human Resource Committee at the fund. NHIF was also faulted for planning to procure a new information system at a cost of 4.2 billion shillings to replace the current one that cost 1.6 billion shillings.
Based on the procurement plan, it's a new ERP system implemented in 4 phases at a total cost of about 4.2 billion shillings.
The MPs have stopped the procurement, terming it as a wastage of public resources.
We will not allow you to spend that money carelessly like that. You've spent already 1.6 billion to procure the system which you have. You want to put that 1.6 aside and spend another 4.2.
Chair, that is noted. We will provide the documents that are available.
Honorable Chair, I get a feeling that this particular NHIF have suppressed the system to allow things to be done manually, and the end result is what we have seen, Chair, the NHIF scandal.
The Watchdog Committee has summoned NHIF ICT Director and Principal Secretary for Information Communication Technology and Digital Economy to expound on the procurement of the new system. This comes as the Health Cabinet Secretary, that is Susan Nakhumicha, has revealed that she will make changes, especially in the top management of the National Hospital Insurance Fund in the coming days. Abdiaziz Hashim from Parliament Buildings, Prime Edition.